You can set goals for yourself, but you don't always achieve what you in the moment think you should achieve because you may think it's the right path, but it may not actually be the path that you're supposed to be on. With pathology, I have always felt that I was always going in the right direction. So in that moment when I won the election, I truly felt that I had achieved what my peers wanted me to achieve. They wanted me to be in that moment. They wanted me to be a leader for CAP for the next 5 years, to really have their voices be heard and be a leader for them.
Welcome to the People of Pathology podcast. I'm Dennis String. On this podcast, we explore pathology, one story at a time, and connect with the people behind the diagnosis. Today, I'm honored to be joined by the president-elect of the College of American Pathologists, Dr. Kalisha Hill. Dr. Hill's recently published memoir is called Pinnacles, Visible and Invisible. We'll discuss her career so far and the lessons she has learned about resilience and leadership. Then we'll talk about her work with the CAP and what it really means to reach a pinnacle. All right, let's get into this conversation with Dr. Kalisha Hill. Your memoir, it's called Pinnacles, Visible and Invisible, was just published earlier this year. And I'm curious, to begin with, why was now the right time to write this book?
I had not anticipated the current area that we're in and the current circumstance that we're in. I started writing the book during the pandemic. I found it very therapeutic to reflect on life, particularly as we were making such an effort to save lives. So it was an opportunity for me to explore my origins and also current state and how I arrived at that place. So I had not anticipated actually having the book published 2 years later and having the circumstances be very different.
So you said you started it during the pandemic, like at the beginning. I mean, was this in 2020?
So I started it in 2023. And by that
Okay.
point, we were beyond the masking and vaccines, but we were at a place where people were still very ill and chronic illnesses were occurring. So the acuteness of it had subsided, but the realization of its impact and the chronicity of the disease was quite real.
How much did that change? I mean, you must have had an idea or direction for the book at the beginning, and then going through the pandemic. How much did that change?
I will say it changed over time from an analysis to an experience, meaning some points
Hmm.
were written about historical, and then I found myself writing real time. And I think that contrast from past to present and then anticipation of what would come in the future was not fully realized as I was writing the book until I completed it this year.
All right. Now, the idea of a pinnacle is something that you explore throughout the book. So first of all, I want to know, what does a pinnacle mean to you? And then let's get into how you decided on this for a title.
So I always had been focused on goals. And most humans are taught to set goals for themselves, to have a timeline for them, and make efforts to achieve them. I did not want to have the book titled with an obvious turn, but the term pinnacle just resonated with me because I had been on such a trajectory with so many aspects of my life, setting goals, evaluating what I wanted to achieve and why. So pinnacle seemed to be the appropriate title. And then the invisible component really came later once I realized that when you set a goal, some of them are very tangible. You can say, okay, this is the title I've achieved. This is the project that I've completed. This is the work of art that's now done. But what's invisible is the work that it took to get there. And that's the part that people don't see.
For sure. Okay. The beginning part of the book, you described your upbringing and especially the involvement of family. So your parents, your grandmother, your aunt, especially. Are there some lessons that you took from all the way back at the beginning, your upbringing, that you think still influence your work today?
So even today, at this point in my career, after a couple of decades in practice, I still find myself learning new circumstances to navigate, meeting new people and personalities that I have to work with or spend time with socially, and find myself reflecting back on how my family members would have approached circumstances. And when times are particularly challenging and difficult, or when there's an emotional toll that occurs, I remind myself, and I often share this with my children, when things seem very bad or when things seem impossible, just take a moment and reflect what it took for you to get to this moment. What occurred for you to be at a place where you are in your life? And as you start counting backwards, you start seeing the people who came before you, your parents, your grandparents, your great grandparents, and put yourself in their shoes and see, is your circumstance any more difficult than what they experienced? And often the answer is nowhere close. So that does give you courage that if my ancestors and my grandparents and my family members could be resilient, then I should be as well.
Okay. Is this something that when you do this yourself, you automatically do this? Did you have to kind of practice or train yourself to think in this way?
I think life is the best teacher.
Okay.
Yeah. So I do believe that people use different tools to develop good habits so that they are able to adjust and react real time to the unexpected. But there's nothing to replace time and experience. And that is the best teacher. I think it provides the best wisdom. And each person has to evaluate what tools works for them. So for me, I had been through enough circumstances in my life so that now even the most challenging moment appears to be something that can be achieved.
I like that. That's a good perspective. I think a good attitude to have during challenges for sure. So in medical school, you were initially drawn to surgery and then you were exploring different, I guess, subspecialties of surgery and which ones appeal to you. And during one of these, during your gynecologic oncology rotation, you had an experience interacting with a pathologist or seeing a pathologist that changed your path. Can you tell me how that happened?
Yes. So I have always been a hands-on person, even as a child. My great grandmother, when she would bake, she would give me the dough, and I wouldn't just try to make things to eat with it. I would try to build and sculpt. And I like to draw. So I was very much drawn to anything that required my hands. So surgery was a natural attraction, being able to make incisions, being able to dissect, all of those aspects that really do require tactile stimulation and simultaneous critical thinking has always been very stimulating to me. So I really enjoyed gynecologic oncology because it included women's health, it included cancer treatment, it really included doing major surgery that would have a direct impact on the longevity of another person. But there was this one surgeon who would take the uteri down to the pathologist, and he would stand there waiting for the pathologist to open the specimen and do the examination. And so, as a medical student, just watching this process and this very muscular, tall surgeon towering over this petite woman as she's evaluating this uterus, and he is just standing there in awe of her and very curious, almost like a child waiting with bated breath to see what she was going to say to him and how her words were impacting his next step in the surgery. To me, that was very powerful to watch her have that kind of authority. And it only took a couple of days of me following him down to pathology and going back up with him to surgery to realize I actually enjoyed and wanted to find out more about what was occurring in pathology. So he allowed me to stay down there after he would bring the specimen for the remainder of that week. And I got to follow through to see what happened with that specimen and what they did and how they evaluated it, made it into slides, generated a report, called the surgeon with their final diagnosis and assessment, and really understood how that would impact the course of treatment for the patient.
That story is interesting in a number of ways, but for me personally, because I'm a pathologist assistant, so the fact that you became interested in pathology through the gross specimen, I think is really cool from my perspective.
So that is worthy of conversation. I had this discussion at the residence forum during a meeting of the College of American Pathologists. And one of the residents made the comment that they felt that doing so much grossing was unnecessary and they only needed to do a certain number. And I had to stand up and reinforce that no specimen is unnecessary. Each specimen that is taken from a patient, a major part of the joy is that you don't know what you're going to find. So after that 90th gallbladder, that 91st gallbladder may be the one that has a cancer in it, that because you grossed those previous 90, you know how to recognize an abnormality and take that particular section and put it through so the patient would get adequate treatment and not come back with metastatic carcinoma. It's a huge impact on our patients when we take the time and skill and knowledge to grow specimens effectively. It is a worthy endeavor.
Okay, I love that. I agree 100%. Thank you for saying that. So you decided you wanted to go into pathology, and after spending some time in the pathology department, how did it progress from there?
Even when I was in the pathology department, observing the pathologists and all the great work they were doing, I was still in my third year, so I had not fully experienced all of my rotations. So
Okay.
I continued doing various surgical electives, trying to identify which specialty was right for me. And so I did urology, I did cardiothoracic surgery. What I realized was that it wasn't just the cutting of the specimens, it was the finality of making a diagnosis that I was really attracted to. So I decided to do an elective at Northwestern, and that was the deciding moment. The attendings and the residents were so collegial. They truly enjoyed teaching and learning. It was a collaborative environment, and it literally took 3 weeks. And I knew that was the specialty for me as well as the place that I wanted to train.
That's an inspiring story. Now, going back to the book, you describe your first College of American Pathologist or CAP meeting and residence forum, and you've been involved with the CAP ever since. For me, I mean, we have a pathologist assistant organization that I'm involved with. I feel like being involved in professional organizations is really important, both for yourself personally and to give back to your field. What do you think about this?
Aligning with like minded individuals, regardless of your profession, always enriches you. And it doesn't just enrich you, it enriches your skill and how you perform your duties as an individual, regardless of what industry you're in. So, as a pathologist, it's particularly meaningful because pathologists are very unique in the way they see the world. There's a certain level of desire for expertise and detail orientation that when you meet someone else with that similar background, there's an immediate kinship. And spending time with people from around the world doing the same specialty and sharing ideas and collaborating on projects, on committees, and spending social time together, it really does allow strengthening of one as an individual as well as the group collectively. And that experience truly is priceless.
Yeah, I agree with that as well. I think the aspect of just getting a perspective from a different facility, a different part of the country, even a different country, right? All of those things can be helpful.
Yes.
So throughout your career, you've held many leadership positions, both in your own hospital and in the CAP. And you describe a lot of them and some of those experiences in the book. Why is having leadership roles important to you personally?
I had wise mentors that told me to consider yes whenever asked to take on additional roles. So when opportunities presented themselves, for many reasons, it is beneficial to respond with an affirmative response. And I will say that oftentimes, even if you don't feel you're ready, if someone sees in you skills that would be beneficial to the whole, I feel it is your duty to say yes, because you don't know what you may be able to contribute and make your environment better. And particularly in healthcare, when you really could have an impact on someone's life, someone's practice, it is a huge responsibility. And so we do need physicians to step up and take those leadership roles because it truly can make a difference.
For you personally, and I guess in your professional life as well, are there some aspects that, looking back, that you think the experience of these leadership positions has helped you personally and professionally?
Absolutely. So, as a physician, we are defined as leaders automatically. It is an active choice for anyone to be a good leader or a bad leader. The best way to become a good leader is to actually take on leadership roles and gain experience. So, as I took on the role of a physician advisor as a pathologist, and then taking on the role of a chief medical officer, and then taking over the role of two hospitals as chief medical officer in the middle of a pandemic, those experiences cannot be duplicated. And if I had not been present and said yes at the time, I would not have that experience behind me now as I have to lead the College of American Pathologists as the president-elect and future president. So having all of these leadership experiences are truly foundational, and it allows me to serve my patients better because I can see through the lens of the physician, I can see through the lens of the patient, and I can see through the lens of the corporation that is responsible for the stewardship of caring for the patients.
Okay, I like that. It's like the sum of all of those skills makes you better than, I guess, each of those roles individually.
That's exactly right. It is the sum of the whole that makes a person more capable.
This is the People of Pathology podcast with our guest, Dr. Kalisha Hill. We'll be right back. When it comes to cancer staging, one of the most important parts is finding all of the lymph nodes. I should know, it's what I do every day. Yet this process has remained the same for over 100 years, manual, tedious, and time-consuming. That's a problem because every missed lymph node can mean inaccurate cancer staging. That's about to change. Enter InVision from Cision Vision, a first-of-its-kind device that's redefining the standard of care. Traditionally, we identify lymph nodes by sight and feel alone. InVision changes that using short-wave infrared technology to make lymph nodes stand out clearly from surrounding fat and in real time. In its first 104-patient study published in the Journal of Clinical Pathology, InVision helped increase lymph node counts in 86% of cases and even upstage 4% of patients from N0 to N1. I personally contributed to the study, and let me tell you, seeing the technology's impact firsthand was amazing. It's time to invest in grossing innovations that improve patient care. So, how is your lab approaching innovation in grossing? Book a demo at demo.cisionvision.com and start seeing lymph nodes like never before. Are you thinking about applying to a pathologist assistance program and feeling a little lost? That's why I created the Path to PathA, your PA school application blueprint. This is a step-by-step prep course that gives you everything you need for a strong application. From finding shadowing, to writing a standout personal statement, to prepping for interviews, This course was made to help you feel informed, confident, and ready. Visit www.thepath2patha.com to join the mailing list. You'll be the first to hear when the course launches. Your path starts here. Now for the rest of my conversation with Dr. Kalisha Hill on the People of Pathology podcast. One thing I wanted to ask you about, because is some of your hospital leadership positions, they kind of required an understanding of business, of financial aspects. And so you decided to go and earn an MBA to help you acquire those skills. And it seems like from a lot of the pathologists I've talked with, that kind of a basic understanding of business and finance, it's almost required in today's kind of healthcare landscape. What do you think about that?
Unfortunately, they do not teach doctors how to run businesses, and often finance exposure is limited. And it really does a disservice not only to the physician, but also to the patients that are served. You have to have some business understanding to maintain a practice so that you can actually keep the doors open to care for patients. Too many clinics close because the physician does not know how to run a business. And then that becomes a healthcare desert, particularly in a rural area where patients need to be served and they have limited access. So every physician should have some business training, whether you're employed or owning your own practice. And especially now with the reimbursement challenges, we have to be
Yeah.
excellent stewards and have financial understanding of finance so that we can have those conversations with the corporate leadership and the chief financial officers and the CEOs so that we can advocate for patient resources while also being mindful of the financial constraints.
Do you think there's a way to incorporate that kind of education or training in, say, where I work with pathology residents and they're really busy? Do you think there's a way to kind of fit in some financial aspects into that training as well with all the other things they have to learn?
Absolutely. I'll give you an example. When I was a resident, we
Okay.
would gross on Monday, and then the cases we grossed on Monday, we would sign out Tuesday. Usually, once the diagnosis was made and shared with us, we would take the paperwork and hand it to the transcriptionist or have it typed and a report is produced. It would take 5 minutes in doing those cases to explain the CPT code at the bottom of this report correlates with this fee schedule. And then this is how payment is rendered. And when these payments are rendered, we send a bill. And when that bill goes to the insurance company, there's a network rate. So it is adjusted to a certain amount that's actually paid. So when that amount is paid, we have to make sure that the incoming payments exceed the resources required to produce this report. And that starts from the OR time to the specimen processing to generating the slides and making the report.
It seems like there's I guess, a logical pathway there that could be incorporated and residents could have at least a basic understanding of that, right?
Yes.
Okay. We talked a little about how you started the book during the COVID pandemic a little earlier. But I want to say, because in the book you talk about navigating through the pandemic. And we know that it's taught us all a lot of things, some of them not so good, but some of them at least maybe not good, but things to keep in mind. So you navigated the pandemic as both a hospital leader and a CAP leader. What do you think are some of the biggest lessons that you learned from that experience?
I have a greater appreciation of people's thought processes. And more importantly, I gleaned a greater sense of understanding. We had an opportunity to educate, but also allow people to make decisions for themselves. And having a greater understanding of where people are allows greater communication and also helped us effectively implement protocols, even when they weren't always welcome.
Okay, I like that. That makes sense. So earlier this year, you were elected president-elect of the CAP, and you wrote about this journey in the book. And it was a very interesting story to me. I'm curious, why did you decide to run for president of CAP at that time?
So the conversation to run for president actually started when I was on the residents forum. There was a fellow resident And she and I were discussing leadership in the CAP. We were both on the executive committee for the Residents Forum. And she mentioned to me that one of us should be president one day. And I said, that sounded good. And I assumed that it would be her. She was a brilliant, charming person who I still hold very dearly to this day. But our career paths took different trajectories. And I did not realize really how impactful the CAP would be on my life, both personally and professionally. So I never desired to not serve. So from the Residents Forum to this day, I never took a year off from doing committee work. So I decided to wait for my daughters to graduate from high school before running for governor. And that timing was perfect because they were at college and I was in my first term. And then 5 months later, the pandemic hit. So my daughters were back home while doing courses online in my house, and I was doing CAP work virtually. So it really turned out to be a time where we were making critical decisions as a college for our membership to try to assist during this challenging time. But at the same time, I had my daughters home and felt that they were safe. And so that first term led into the second term, and my running for president at this time was very well thought out in terms of the trajectory and the point that I am currently in my life. My leadership in my hospital is very much stabilized. My practice is very much stabilized. And I truly feel that this point in my life, I can truly give back to the CAP all that it has given to me.
Can we talk about the moment that you knew you had won this election? And I know you write about it in the book, but what did that feel like for you?
It felt that I had been chosen. You can set goals for yourself, but you don't always achieve what you in the moment think you should achieve because you may think it's the right path, but it may not actually be the path that you're supposed to be on. With pathology, I have always felt that I was always going in the right direction. So in that moment when I won the election, I truly felt that I had achieved what my peers wanted me to achieve. They wanted me to be in that moment. They wanted me to be a leader for CAP for the next 5 years, to really have their voices be heard and be a leader for them.
Are you able to talk about some of the goals that you have for your upcoming term as CAP president?
Yes, my number one goal is to make sure that we are meeting the needs of all of our members. We have so many subspecialties within pathology and so many subspecialty organizations. I would love for all organizations to function as a unit and work collaboratively with the CAP so that we are advocating for all pathologists, regardless of specialty and practice type. And fortunately, the CAP, as the only legal entity allowed to lobby on behalf of board certified pathologists, I want to make sure that when we are advocating for our practices, that we are reflecting and speaking in one voice for all pathologists.
Okay, I like that. So you end the book with kind of completing the circle and revisiting the beginning. And I like this storytelling device. I try to use it a lot on this podcast, actually, by ending at the beginning. So I'm going to borrow that here. Let's return to the idea of a pinnacle. Now, when you talk about a pinnacle in book, and you mentioned this earlier too, you talk about, is it the achievement or the event itself, or is it the work that went into it? And you write after the CAP election, you write, is the pinnacle truly the election itself, or is it found in the countless goals achieved, the long hours of preparation, the quiet moments of doubt, and the unwavering resilience that ultimately prepared me for this role? How did you come to view pinnacles in this way?
That viewpoint comes from a long history of setting goals and achieving them, or setting goals and not achieving them. Every single pinnacle is one of many, so there's never one. Each step that's required to reach a pinnacle is a pinnacle in and of itself. And that's likely rooted in my childhood experiences, whether I was doing rehearsals for a school play or practicing for a swim meet, or even just trying to learn to do well on an exam. All of those moments of preparation are small pinnacles in and of themselves: achievement in learning something, achievement in perfecting a skill. All of those are small pinnacles to reach a final goal that has been set. So there's never one, there's always multiple. And so that's why I titled the book Pinnacles with an S, to reflect the multiplicity of that experience.
Okay, I like that a lot. I've been thinking about that quote in particular and just your attitude toward pinnacles a lot since I've read the book and trying to apply it to my own life and my own experience. And I think for people that read this book, and I'll link to it in the show notes so people can buy it and read it for themselves, but I think that's one of the biggest lessons from reading it. And also for any medical student, pathology resident, pathologist who's advancing in their career, the lessons that you share, I think, are helpful for all of those people too.
Yes.
All right. So, Dr. Hill, thank you so much. This has been a really interesting conversation. I appreciate getting to know you a little bit more, talking about your book, which I really enjoyed. So, Dr. Kalisha Hill, thank you so much.
Thank you.
If you're looking for another episode of the People of Pathology podcast to check out after this one, here's a clip from my interview with Dr. Emily Volk as we talk about how the concept of first do no harm also applies to leadership.
If somebody would call me with a problem, I wanted to address it right away. I still struggle with this, to tell you the truth. That, I want to stop suffering. I want to fix the problem. And I also kind of like having the Superman cape on. Who doesn't love to be able to come in and solve something and swoop in?
Sure.
What I've learned though is sometimes that is not the best answer, and it's not the best response. And so it occurred to me that first do no harm actually applied to leadership, that you're presented with a situation and sometimes doing nothing is the best thing. And sometimes maybe it's just you need to ask more questions, but rushing in to fix it with the first pass of information, which is usually not all the information, right? Often it's really wrong information. Doing that can actually cause more harm than good.
You can hear more from Dr. Emily Volk in episode 190. All right, big thanks to Dr. Kalisha Hill. Wasn't that an inspiring conversation? I think there are 3 key takeaways from this episode. The first is the importance of leadership roles. Dr. Hill was guided by mentors to say yes whenever these opportunities came up. This led her from the CAP Residence Forum to president-elect, as well as many leadership roles within her hospital. So the next time an opportunity like this comes up for you, try making yes your default answer. As Dr. Hill's story shows, you never know how far these opportunities could go and how much you could grow as a result. And speaking of growth, that's the second lesson. Not only did her leadership roles help her to grow, but Dr. Hill also recognized when there were gaps in her own skill set. And then she actively went about filling those gaps. So a perfect example is when she realized that her hospital leadership roles required some knowledge of finance. So she made the choice to pursue an MBA to help her acquire those skills. Now look, learning new skills doesn't always mean earning another degree, but it does mean being open to the fact that you don't know everything, and then identifying the best way to learn what you don't know. It's the concept of lifelong learning, which we've talked about many times on this podcast. Finally, the theme of pinnacles returned again and again throughout this conversation, as it does throughout Dr. Hill's book. And this is the third lesson. What is a pinnacle really? For Dr. Hill, pinnacles aren't just achievements or titles. They're the cumulative result of persistence, resilience, and purpose. They're the hard work, the late nights, the difficult decisions. The visible successes are only part of the story. It's the invisible moments that are in fact the real pinnacles. Whether you're a student, a resident, or you've been in this field for decades, Dr. Hill's message resonates. Success isn't a single pinnacle. It's a series of climbs, each one shaping who we become along the way. Again, the book is called Pinnacles, Visible and Invisible, and I'll include a link to it in the show notes. Don't forget you can follow the show at People of Path on both Instagram and Twitter, or you can just connect with me on LinkedIn. Thank you for continuing to share the show with others. Together, let's inspire the next generation of pathologists and laboratory professionals. This show is a member of Health Podcast Network. Thanks for listening. I'm Dennis Strank, and I'll talk to you next time on the People of Pathology podcast.